I'm Elizabeth Hinkson with Education, and for this short video we're going to talk about trach assessment and also a trach dressing change. Trach section is on a separate video located on the same site. We're going to look at trach site assessment and trach site dressing change. Now this skill is shared between nursing and respiratory. For nursing, it is important for us to remember that like any dressing, if it's wet or soiled or has mucus on it, you really can't leave it there. It's a pretty significant infection risk. So it is often that you'll be changing this several times in your shift. We don't usually aren't able to wait for respiratory, who will also be doing the same thing. So we're looking at our dressing and we're noting it for discharge. So we're just going to slide it out. Now we're going to tug gently to remove it. We can place our fingers on the actual plastic of the trach there and just slide out our old dressing. Like any other dressing, we're looking at the discharge for anything concerning such as infection, color, amounts, all of that. So then we're on to the actual trach. So there's the plastic portion of the trach that we are going to clean, but what we're really looking for as far as assessment is behind the plastic at the actual stoma. Now a stoma up here is not all that different than a stoma that you would see for a colostomy, in the sense that it should be pink and moist. Flaming beefy red makes you think more of infection, especially with discharge. There might be, especially if it's new, a little bit of blood, but not a copious amount. And then we're on to cleaning. After we assess, and we're particularly looking for areas that might be pressure areas. If your trach is new or sutured in, then your likelihood of seeing a pressure area injury under there is a little bit higher. So make sure that we're actually visualizing all of the stoma around the plastic. So now we're on to, well, let's clean the stoma and then put on a new dressing. Okay. So for cleaning, we're just going to use some 4x4s, the boat works well, and some 250 of saline that you've got out of your clean utility room. You may also find that Q-tips located in your bedside cart may also be useful. So I'm just going to open these up for a second. We remind our patient that this is going to feel a little cold and wet. And so 4x4s are good for the outside, for the plastic. In the edge, you want it to look shiny new in the same way it did when it was first placed in. Crusties or hardened bits of mucus need to be removed because they are an infection risk, right? So we're going to move all the way around here. We're cleaning up under their skin fold, under their chin. Any mucus is kind of rolled down under there. So we're going to pull off all of that so it looks all nice and shiny new. Now, for the actual stoma, this is the part where you may find the Q-tips are valuable, right? So stick those in our saline as well, and then we can use these to come underneath to gently clean off any crustaceans that have gotten stuck there, so that everything looks as new as when it was first put in. Once we're done with that, then we are ready to place a new dressing. Most clean utility rooms should have the slitted dressing where we just slide it up one side and then the other. And we do this gently because when we push on the stoma or the trach, we tend to make people cough and gag, so we try to avoid that. But we just slide it up there, and we're back in business. If I don't actually have one of these pre-slitted dressings, I can get 2x2s out of my bedside cart. I fold them in half, and I slide one up each side. The purpose of the dressing is to protect the skin and the stoma from the plastic. So either way, we have a new dressing. And then we're good until, again, we find it, they've coughed out extra mucus or there's something that has soiled the dressing, and we need to change it again. That concludes our trach assessment and trach care video. If you have any questions, make sure that you speak with your respiratory therapist. Also be sure that you document your site assessment and your dressing change in Epic. communicate anything that is different from normal with your provider.